Hi, I'm Dr. T. Scarlett, and I want to talk to you about gallbladder issues. And gallbladder issues are one of the most common causes for people to have ongoing chronic gastrointestinal symptoms that are commonly missed because no one really diagnosed the gallbladder problem. So when I use the word gallbladder problem, what I'm really not referring to are gallstones. Gallstones are pretty obvious to diagnose. Someone has an acute response, they have pain, they have fever, they have abdominal pain, and they usually go and get checked out in the emergency room and everything's fine. But there are many people that have a pre-gallstone obstruction, which is really called biliary stasis, where the bile really gets thickened. Sometimes on ultrasound they'll show up as gallstones that haven't obstructed the gallbladder yet, but they're just waiting there. And other times it just doesn't show up at all. So one of the things that we know clinically is that when people start to have inefficient bile release because their bile gets really thick, is that they have bloating and burping, they have intolerance to fatty foods. But really what happens is that these patients end up not being able to digest fats very well. And when they can't digest fats very well, these undigested fat particles have a significant impact on adverse bacteria in the gut. So you get this dysbiotic condition that's developed, and you get bloating and distension, and you have a whole set of mechanisms that take place that really lead to ongoing chronic bloating, distension, constipation issues, floating stools. And many of these patients are missing the healthcare system because when they walk into the conventional healthcare system, since they have gallstones, they're really not worried about them. And then for patients that walk into the alternative healthcare system, there's such a focus on their gut, and they're usually supplemented with so many things to support the GI tract itself, like different strains of probiotics or digestive enzymes or pre-fiber products or different gut drinks or anti-inflammatory protocols or green compounds and so forth. But they don't really address the underlying gallbladder issue. And for many patients that who have gallbladder issues, they stop eating fried foods or fatty foods, but they still consume things like avocado or olive oil, so they have some subtle distension and they don't have the gallbladder attacks. That clinicians typically miss it. But one of the things that you should know is that a common cause for patients that are taking every single supplement out there to support the gut and are still not getting better, still have bloating and distension, is that they actually have a gallbladder issue. And this is especially common in females over the age of 40 that are overweight and have had kids. Those dynamics lead to hormonal shifts that really causes biliary stasis. So whenever a patient comes in and they tell you that they burp when they take fish oils, if they ever complain of floating stool, if they tell you they can't eat any fried foods, as you dig deeper into their gastrointestinal history, those all suggest that there could be an underlying gallbladder issue. We're going to go over these clinical concepts and strategies in the Karazian Institute course called Gastrointestinal Clinical Strategies and Treatment Applications in great detail. And gallbladder dysfunctions are one of many, many different mechanisms that are overlooked in the healthcare system that lead to many patients having chronic gastrointestinal problems. So thank you for your attention.